Hello, everyone. I'm so glad you are here. Today, I'm going to share a personal story with you, and that is about how I found myself or my way into the clinical quality space. And before I get into the details about my personal journey in this space, I want to say that when I got into clinical quality over a decade ago, I was new to this space, had no knowledge what clinical quality is, and I was looking for materials. I was looking for resources that would help me to learn about clinical quality and for me to understand what this space is all about, and so I can excel in my role and do my job with purpose. That was a struggle. There weren't curated content to support clinical staff or clinical quality staff, and even to date I still see that gap. So I created this channel to provide content or curated content for clinical quality folks that are seeking to grow in their role, or even folks that are exploring clinical quality as a potential career path. My job, or what I want to do, is to provide practical insight, provide strategic advice or guidance or even life skills, real life skills that will help you to be able to succeed in clinical quality. Okay. My hope for this video is that you feel inspired to explore this meaningful field, no matter where you come from or no matter your background. Okay. So if you're someone who is looking to learn about clinical quality or want to explore this as a potential career path, or looking for how you'll be able to grow in your role as a clinical quality professional, then you are in the right place. Well, growing up for me, I knew, deep down that healthcare is what I wanted to do. As a matter of fact, my earliest memory is during my kindergarten days. We had a kindergarten graduation skit where I played the role of a doctor. I vividly remember I had on, the doctor's robe and standing beside another kid that played the role of a patient, right? And to date, and there's even a picture of that moment. Every time I take a look at that picture, it reminds me that deep down inside of me, I always wanted to help people. But then life doesn't always take us in, the straight path to fulfill our purpose. Sometimes you go through different channels and different loops to be able to get to your place of purpose, and that was my case. Before I got into clinical quality, I started as a customer service agent. I worked for a legal firm that back in 2008, they handled the legal settlement for the folks that were impacted by the BP oil spills. How many of you remember that? And also they handled the legal settlement for the folks that were impacted by the 2008 the Wall Street economic crash. There were a lot of people that lost their investment in stocks and 401ks, and we handled the settlement of those folks. I mean, I know this story is not about that, but there were a lot of horror stories I saw. I mean, I saw folks that had thousands in investment, and they got pennies back in return. It was awful and also very depressing, going through that moment, and working under that environment. And then I got promoted to a quality assurance analyst, where I was no longer taking calls, but I was now listening to the calls recorded for other agents, and I'll provide tips on how, the areas they missed and what they need to do better in order to be able to support, the clients or customers that were calling. From there, I worked for a managed care organization that was mainly specialized in pharmaceutical, medication refills. I worked as a customer service agent for, and then I went back to school in 2011 to complete my bachelor studies, and in 2013 I graduated with a bachelor's in healthcare administration from Kaplan University. Well, I mean, if for any graduates, when you finish your studies, you are very optimistic, you are very passionate, and very you have the desire to really make a difference. So you are looking for that immediate job opportunity for you to be able to land that dream job, right, for which you went to school for. So I stayed home for about 3 months applying for different healthcare administration jobs, and there were no interviews, there were no replies from any of the applications. As a matter of fact, it became so frustrating for me that I now was walking into offices, and I will walk into clinics and hospitals close by with my resume, and I will ask them, are they hiring for healthcare administration roles? And how ignorant and naive I was to think I can just walk into any healthcare or into any clinic or hospital and ask if they're hiring, and they will tell me, sure, we're hiring, come in. Well, that did not pan out. But I never lost, the passion and the drive to keep pushing. So I lived close to Molina Healthcare. Then I was about 5 to 10 minutes away from Molina Healthcare, and I walked into Molina Healthcare, and I asked them the same question. Hey, I have a bachelor's degree in healthcare administration. I have my background in customer service and also helping clients, and I'm great administrative and also organizational skills. I'm looking for a job. And fortunately, they told me they have a job fair coming up. So they gave me the details, they gave me the time, and I went back home to prepare. On the very day I came to the job fair, and I was applying for anything quality. Obviously, why? Because my last role was related to quality assurance and customer service, and not really had no clue about what quality in healthcare or quality in the managed care meant. So I applied for anything relating to quality. Unfortunately, they were conducting interviews during the job fair. So I happened to interview, shared my background and the skills that I have, and that was it. I went home. I didn't have my hopes up because previous job opportunities or applications have not turned out. So I really didn't have my hopes up. Well, to my surprise, 2 hours after, I got a phone call from the HR that the hiring manager in the quality improvement department at Molina Healthcare wanted to interview me. Then for a quality improvement coordinator role. I was very excited. I have no clue what the role is or the details about that role, but I was very driven, and I wanted to get in the field and be able to work with my degree. So I went for the job interview, and I was offered a job as a quality improvement coordinator, and that is how I found myself in a clinical quality space. So I started working as a HEDIS coordinator in the quality department, and this was a team that was responsible for anything quality improvement in that managed organization. As far as member engagement is concerned, or provider engagement, quality improvement initiatives to be able to drive health outcomes and also, close care gaps. They were also responsible for managing both retrospective and prospective medical review campaigns. When I joined the team, this was a team about, I believe, maybe 20 to 30, if I'm not mistaken. Eventually, more folks were hired on, and they were full of, clinical folks with clinical backgrounds, RNs and LPNs, and also folks with MPH. And for me, I had, strong analytics insight. I loved working with data and really manipulating data to be able to draw meaning from data. I loved putting together charts, providing tools to increase efficiency, and that was one area that the team lacked. They lacked because they were all clinical folks, and most clinical folks are not really um, 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 are not really, I wouldn't say talented, but they're really not good in when it comes to building um, tools and working in Microsoft Excel and all. They are very good when it comes to the medical background and also working with patients and the doctors in that medical realm. So I came in, I was able to have an immediate impact by creating tools that will help them to bring efficiency. I vividly remember during the retrospective medical record review project that year, um, I created a mail merge process that automated the chat request creation. And this was over a decade ago, right? How medical records request is managed today, it's way different from how it used to be managed 10 years ago. 10 years ago, it was very mundane, very manual. Folks will basically, it's just essentially take the paper, fill it out, put the fax number on the paper, and then fax it out to the doctor. That is how it was. Um, but then it wasn't efficient. So I came up with a process and a system to be able to automate that, which helped the team to be able to scale with medical records and also medical retrieval. Then I built tools to enable them to track medical record review, productivity, and all of that. So that was my exposure to clinical quality. And then I realized that clinical quality is not about checking the box. It's about ensuring that members receive the right care at the right time and in the right way. It's about process improvement, teamwork, and also ultimately working to improve the healthcare for the lives of people so they're able to live a healthy life. So if you're still watching this video and wondering how you can break into clinical quality, or if you feel stuck where you are right now, I want you to know this. There is a path for you. Whether you come from the clinical background or administration or the hospitality space, or even something like finance, like I did, your skills can translate. What matters the most is your passion for improving care and also your willingness to learn. The clinical quality space is a continuous um, field that is always updating with information. There's always policy changes. There are always improvements coming up, and your willingness to be able to adapt to the changes and be able to learn would help you to be able to succeed. When I started, got into clinical quality, I have no knowledge about this field. And that was a struggle for me. And I also have no clinical background. Okay. I had education in healthcare and business administration, but I had no knowledge of what clinical quality is. And for me, the first coordinator job was the beginning, right? And since then, I've grown from becoming a coordinator into a specialist, into an analyst, moved up from an analyst to a clinical quality manager, where I was responsible for managing HIDIS projects for multiple states, and then moved up into a stars manager, where I was now responsible for managing, team, driving stars initiatives, coming up with both member and provider initiatives to be able to drive health outcomes and also improve star measure performance and drive star ratings. And then moved up from stars manager to a strategic products manager. I started over, like I said, over a decade ago, earning $32,000, if I can remember right, to now where I'm making over six figures, right, with no clinical background, right? And it is possible. It doesn't matter if you have clinical background or you don't have clinical background. So far as you care about improving the lives of people, so far as you care about improving care, and you are willing to learn and you are willing to show up and put your best effort forward, you are definitely going to shine. You're definitely going to grow. You're definitely going to advance in this role, right? So my goal here, again, is to use my experience, my insight, and my background in this space to be able to um, provide tips for you all. This field is still growing, and there are a lot of opportunities out there. I got into clinical quality as a QI coordinator with bachelor's degree. From there, I pursued further with my education and earned my MBA in healthcare, completed my MBA, and then advanced into my doctoral studies in business administration with a concentration in healthcare administration, mainly in leadership practices in healthcare organizations. I also have certification in healthcare quality, CPHQ, which is the gold standard in clinical quality. I'm also Lean Six Sigma certified, and also hold certification in project management. So I've been, in this space. I don't think I know it all. Obviously, nobody knows it all. I am still learning, but I believe I have gained enough experience and enough insight over a decade in this field to be able to learn over my experience to help others who are new or who are also looking forward to grow, for them to be able to leverage. All right. I have created an ebook for clinical quality professionals. So if you are new to this field, if you want to break into this field, land your first job, my ebook will basically is the practical guide you need, that would enable you, will give you the steps on how you'll be able to break into this field. The things that I did not have when I got into this field, I have really poured my heart and myself into this ebook to provide all that information, breaking down what clinical quality is. And again, this is not a clinical quality, technical oriented ebook. No, it's mainly curated to enable professionals land a job in this role, or enable professionals grow in this field. Provide direction on how you'll be able to look for jobs, what roles are available in this field, the earning potential, what certifications, how you can get a mentor. I provide scripts and also templates that you can use. I even also put together a job application tracker that would help you to be able to track all your job applications and be able to see where things are. And also even provided a 90-day planner that will help you to be able to land your job within 90 days. In addition, I've also added a bonus resource, which is a 90-day goal in your first, in your new position as a clinical quality professional. These are tools that I did not have when I started, and I struggled, right? And I've built this tool. I still use these tools today to enable me to be efficient and to succeed. And these are tools that I'm providing as a bonus resource. Most importantly, I've also compiled a list or a directory of various healthcare organizations or managed care organizations, hospitals, clinical quality vendors that are always hiring for clinical quality roles. And that there are over 100 organizations that have compiled in that tool with a direct link to their career page. So this will save you a ton of time. 15 years ago, when I was trying to land a job, I would go on Google and just type in anything healthcare administration, and at some point I got tired or ran out of keywords to use to be able to find a relatable job that I could apply for. I was just all over the place. But with this tool, it takes you directly, it has the link or to the career site for these various organizations. You no longer have to go to Google trying to figure out how to apply to this company, or what company can I apply for, for clinical quality roles. And even in that tool, I list out the roles that these organizations are applying or are hiring for. Again, I'm not guaranteeing that when you apply, you're going to get a job. If you're looking for a coaching session where I can coach you to land your first job, you can definitely reach out to me, and I can, give you that coaching services. So this tool is a tool that you need to take you directly to the sites that you need to submit the application to the right folks, that will help you to get the attention you need for you to be able to land your job. If you really like this video, subscribe to my channel, like this video, share with someone that you think will also benefit, and leave a comment. Let me know what you think about this video, and if there are any questions you have, don't hesitate to put it in the chat and I will answer. Take care.